Hello, my name is Sean Morgan, and I currently serve as the Associate EMS Medical Director for Denver Health Paramedics. This work was done during my fellowship at the University of Cincinnati, and I want to thank my co-fellows, Jordan Gray and Woodrow Sams, as well as our mentor, Dr. Jason McMullen. Tenets of high-quality out-of-hospital cardiac arrest resuscitation include early recognition and treatment of shockable rhythms and minimizing the interruptions in chest compressions. Mechanical chest compression devices, like the Lucas, are becoming more commonly used in the pre-hospital setting. However, little is known about how the use of a mechanical compression device impacts these important elements. We hypothesize that a use of such a device is associated with prolonged pauses and compressions, as well as delays in rhythm checks intervals. In order to investigate this, we systematically reviewed charts from a large, urban, fire-based EMS system to identify consecutive cases of out-of-hospital cardiac arrest over a 4-month period. We manually extracted CPR metrics from non-traumatic cardiac arrest cases that met the following criteria. 1, a Lucas device needed to be used. 2nd, there needed to be more than 10 minutes of resuscitation. And lastly, there had to be a complete LifePak 15 monitor file attached to the patient care report. We primarily reviewed each case for compression pause segments, defined as at least 10 compressions followed by at least 5 seconds of no compressions. Each pause was further evaluated for possible associated actions, such as airway management, shown by end-tidal CO2 signal following the pause, defibrillation, or Lucas device placement, shown when there was a consistent compression rate of 102 following the pause. The abstractors use a data dictionary along with standardized case report forms and trained on common cases until less than 10% variance was achieved. The EMS agency, through its 100% cardiac arrest CQI, strives for providers to perform a compression rate of 100 to 110 compressions per minute, rhythm checks every 2 minutes, and to minimize pauses and compressions to no greater than 10 seconds. Of note, this EMS agency has been using the Lucas device for greater than 2 years prior to the start of this study. For analysis, descriptive statistics, chi-squared, and Kurzweil-Wallace tests were used as appropriate. The investigators identified 58 cases that met the inclusion criteria and were included for analysis. Overall, 633 compression pause segments were analyzed. This included 517 segments with mechanical chest compressions and the remaining 116 segments with manual compressions. Figure 1 in the middle column on the top depicts the compression duration measured in seconds between pauses. On the x-axis is the duration grouped in 30-second intervals, and the y-axis is the frequency or the absolute number of compression segments in each group. This frequency is subdivided into 2 groups. The red columns depict manual compressions without the Lucas device, whereas the gray column depicts with the Lucas device. The light green box noted in figure 1 highlights the time interval between 91 and 150 seconds, which represents acceptable spacing for rhythm checks. You can see that the longer durations without pauses were seen when the Lucas device was used, again, depicted by the gray columns. In fact, the median compression interval when the Lucas was not in use was 38 seconds, compared to when it was used, it was 133 seconds. Figure 2 on the middle bottom depicts the major etiologies for pauses and compressions. This includes placement of an advanced airway, placement of a mechanical compression device, and defibrillation. The gray shading illustrates a pause that is less than or equal to 10 seconds, which is contrasted to the red shading that illustrates greater than or 10 seconds. Our data demonstrated that the majority of advanced airways were placed and defibrillation delivered in under 10 seconds, while it generally took more than 10 seconds to apply the Lucas device. Figure 3 on the top right-hand side is an example of a resuscitation file that would be attached to a patient care report. This depicts that the first 8 minutes of a resuscitation. The vertical red lines are compressions, while the blue points or the upside down V's indicate points of ventilation throughout the arrest. 3 things can be seen from this figure. First, there was no pause when there was a placement for an advanced airway. Second, it took about 30 seconds for the application of the Lucas device at the beginning of the resuscitation. This can be seen from time 1 minute, 28 seconds to about 2 minutes, 2 seconds. And third, there was about 6 minutes until the first rhythm check at time about 8 minutes and 8 seconds after the application of the Lucas. In conclusion, we found that using the Lucas was associated with longer intervals between rhythm cycles, and device application resulted in longer pauses than airway management in defibrillation. However, the impact for clinical significance on patient outcomes requires further studies.